It is 6:44. As Hispanic Heritage Month winds down, we're taking a closer look at health issues affecting the Hispanic and Latino communities, including those right here in Connecticut.
The 2020 census data shows that people of Hispanic and Latino background make up more than 16% of our state's population. Healthcare providers say diabetes is a growing concern, especially among women.
Channel 3 Eyewitness News reporter Audrey Russo live in the studio this morning to explain, Audrey, what other communities around the country are doing to fight it.
Well, Caitlin, research shows that people of Hispanic and Latino backgrounds are more likely to develop type 2 diabetes than non-Hispanic whites. The National Hispanic Medical Association is now educating health professionals on different diets and exercise plans that can stop the disease in its tracks. Inside Tyler Heights Elementary School in Annapolis, Maryland, these women are dancing to try to lower their risk of developing diabetes.
Latinos are just genetically more likely to get diabetes. You have social determinants of health, which is key. Access to healthy foods, access to being able to go out and exercise.
Community health provider Alexa Moran runs this diabetes prevention program for Luminous Health. It's funded by a 2-year grant from the state. She also teaches this group about making healthier food choices. Moran says the idea for the program came to her while managing a pop-up vaccine clinic during the pandemic.
It created an opportunity to ask those people, what do you need, what are you looking for, and to really see all of that they were struggling with, like no meds, no access to health care, and all of these other social determinants of health that really became apparent.
For 400 years, we've been at this work, right? And disparities still exist. We have to be intentional and deliberate in acknowledging those differences and making that a part of the way that we deliver care.
Taking a step closer towards prevention while embracing their unique needs. Now, like many programs aimed at stopping a disease, this recent push to curb diabetes in Hispanic and Latino populations comes with federal dollars for nutrition programs. The Biden administration is targeting $8 billion towards better nutrition nationwide. Live in studio, Audrey Russo for Channel 3 Eyewitness News.
All right, thanks, Audrey.